In this presentation, I will talk about the etiology of the pulpal diseases. Like any other connective tissue in our body, the connective tissue that is present in the core of our teeth, which is the pulpal tissue, has some diseases, but the most common disease that affects this tissue is the inflammation of this tissue, which is called as pulpitis. And like the inflammations that affect the other tissues in our body is caused by basically three factors: biological factors, physical factors, and chemical factors. And of course, might be because of a combination of these factors. The first factors, which are the biological factors. Guys, you should know that in our oral cavities we have viruses, and the most important and famous ones are the human papilloma viruses and the herpes viruses. The human papilloma viruses are basically located in the pharynx, and we also have fungi in our oral cavities, and the most important one and famous one, which is the CANDIDA albicans fungi. And also we have more than 300 species of bacteria in our oral cavities. But the most important of these microorganisms are the caries bacteria, or the bacteria that are associated with the dental caries. We cannot absolve the viruses or fungi from causing pulpitis, but until this moment there is no dentist ever that has done a famous research accusing viruses or fungi in doing the pulpitis until this moment. And what we know for now is that the caries bacteria are the microorganisms that are responsible for the vast majority of the pulpitis cases. I do not absolve the viruses and fungi, of course, but there is no evidence for their accusation. The second factors that may cause pulpitis are the physical factors. And when I say the physical factors, I mean for example, the orthodontic work. When we do some orthodontic work, of course, the forces and the trauma that affects the tooth will lead primarily to periodontitis, but they may also affect the pulpal integrity and health. The same is true for the malocclusion. And for example, when you have a deep bite and you are applying continuous trauma for your opposing tooth, if you are a lower central and you are in a mouth with malocclusion, you are continually hitting the opposing upper central and causing trauma for it, so that this will of course lead to pulpitis and pain, and as we said, primarily will cause periodontitis, but it may also cause pulpitis. The same is also true, and this is the case after so many cases in the clinic. You will see that you do the following in a very well situation, but after some days your patient comes to you and says that he has some pain, and the solution is very simple, because there might be a high spot that you didn't notice and didn't remove, that led to basically periodontitis and pain on biting, but also might affect the pulpal health and integrity. from the physical factors, also the heat that is produced during the tooth preparation procedures and polishing procedures. Guys, the heat is produced in a huge amount during the turbine movements because, as you know, the rotation of it is so fast, and so that the friction is so much, and so that if you are doing a preparation or a polishing with a brush or a rubber cup, you are firing the tooth unless you are using a cooling system like a water spray. So that it is very important to use a cooling system in association with the polishing procedures or tooth preparation procedures, or you are burning the pulp, because as we said, it is like any other connective tissue in our body. If you apply heat to it, what is going to happen? It will be burned, of course, and in this case you will be the Targaryen in your clinic. So that always be careful for this thing. And or do you know what, just try to turn on the turbine for about 1 minute and turn off the cooling, the water supply for it, and then touch it and see how hot it is. So that it is very important to notice this thing.